Hello friends, welcome to Prostohub and myself Dr. Jolsna. So today we are going to discuss the topic impression materials and procedures in fixed prosthodontics. So this topic was suggested by Dr. Sumairuddin. Thank you doctor for your constant support and topic suggestion. So first of all, let us see the questions that can be asked from this topic in your university exam. So the elastomeric impression materials can be asked as a 10 marker short note. The impression material and techniques for FPD can be a 7 or a 10 mark short note. Recent advances in impression techniques for FPD have been asked for 10 marks. Disinfection of rubber-based impression material is another short note. Compare and contrast properties of various elastomeric impression material have been asked for 7 marks, and monophase impression material is another 10 marker short note. Now the contents include introduction, definitions, ideal properties of impression material, principles of impression material manipulation, the different types of impression materials and techniques of impression making, the advances, and finally conclusion and references. So before beginning, as every time, I request everyone to please do like and share my videos if you're finding them useful, and if you're new to this channel Prosto Hub, please do subscribe and support me. If you have any queries, suggestions, topic that needs to be discussed, or any feedback, do comment below this video or you can mail me at this mail ID. So let's start. So coming to the introduction, the success of a dental restoration mainly depends upon the accuracy of the dental impression. So with proper impression material selection and manipulation, accurate impressions can be obtained for the fabrication of tooth as well as implant supported restoration. However, there are two major deficiencies usually seen. The first one is the prepared subgingival margins of tooth preparation are frequently inadequately recorded in the impression. So this results in a restoration with less than adequate marginal integrity. And another common deficiency is the failure to follow the basic principles inherent to the manipulation of impression materials. That is, usually the stock trays are used extensively, but the importance of controlling the bulk is ignored. Similarly, putty wash materials are also used extensively, but in an inappropriate manner, which results in impression with less than optimal accuracy. So, this is because of the inadequate understanding about the principles of manipulation of impression materials. Therefore, it is important to know the properties of various impression materials and their effect when used with different impression techniques. And this will help to select a technique which will give the maximum benefits with the available materials. Next is the definition of an impression, that is a negative likeness or copy in reverse of the surface of an object, an imprint of the teeth and adjacent structures for use in dentistry. And what is a dental impression? It is a negative imprint or a positive digital image display of intraoral anatomy that is used to cast or print a 3D replica of the anatomic structure that is to be used as a permanent record or in the production of a dental restoration or prosthesis. So that is a GPT-9 definition of dental impression. Coming to the requirements of impression materials, so an impression should exactly duplicate the prepared tooth, and recording of the adjacent teeth, that is other teeth and tissue adjacent to the prepared tooth, must also be recorded accurately, and then the impression should be free of bubbles. Coming to the ideal properties of impression material, the first one being accuracy. So there are two aspects to evaluate the accuracy of impression materials. The first one is, according to American ADA specification number 19, elastomeric impression material should be able to reproduce a fine detail of 25 micrometer or less. And the second aspect is regarding the dimensional accuracy, that is evaluated by measuring tooth to tooth distances within the same quadrant and cross arch. So most of the impression materials available today provide superb accuracy if they are manipulated correctly. The next property is elastic recovery. That is, the impression material should be able to flow readily into the undercut areas in the mouth, set in that position, and should be able to rebound back to its original shape when the set impression is removed from the mouth. So this process is called elastic recovery. No impression material has got 100% elastic recovery, But comparing every elastomeric impression material, the PVS, the polyvinyl siloxane or the adhesion silicon impression material have the best elastic recovery at over 99%. Next is about the dimensional stability. So an ideal impression material would be dimensionally stable over time and can be poured at the convenience of the operator. So here also the polyvinyl siloxane material possesses the ideal dimensional stability and can be poured at the convenience of the operator. But in case of the water-based impression, that is the reversible and irreversible hydrocolloid, these should be poured up within 10 minutes of removal from the mouth and should not be wrapped in a moist paper towel as seems to be a common practice. The impression can easily absorb water from the wet towel and thus distort before pouring. So dimensional stability is also an important property. Next is about the flow. So impression materials should readily flow into the minute details of the cavity preparations and accurately capture the grooves, pinholes, cervical margin details, etc. So it should have a good flow property. And regarding flexibility, the polyether impression material tend to be the least flexible. That means it sets and becomes the most rigid of other material. And this can be a problem when dealing with long and thin preparations of periodontally involved teeth. So there is a chance of fracture of the delicate gypsum dies due to the rigidity of the polyether material. So in such cases, reversible hydrocolloid, which is the least rigid of all material, is the material of choice. That is when making impressions of multiple periodontally compromised teeth. So that is regarding flexibility. Next one is workability. So in order to improve workability, they introduced auto mix devices for mixing the elastomeric impression materials. For example, Pentamix, and also simpler mixing guns is also used in order to provide a standardized mix, and this will improve the working time. So what is working time? It is the time beginning from the start of mixing and it ends just before the elastic properties have developed till the material is manipulative. So the material should have an ideal working time. Next is about hydrophilicity. That means the love towards water. So when is a material said to be hydrophilic? It can be classified as hydrophilic if the contact angle that water makes with the impression material is below a specific angle. So the reversible hydrocolloid impression materials are truly hydrophilic and can effectively make accurate impression in the presence of moisture. Whereas polyether impression materials are also hydrophilic, but they require a dry field for making impression. So earlier the elastomeric impression materials were hydrophobic, and some changes have been made to make it hydrophilic, but still it is not possible to make acceptable impression in a wet environment with the elastomeric impression materials. The next property is shelf life. So the exact shelf life of impression material is not known, but it is not advisable to use the material that have passed the expiry date established by the manufacturer. And next is about the patient comfort. We know that impression materials should not cause any patient discomfort. So the contemporary materials used are essentially colorless, odorless and tasteless, and especially when using full arch impression. The use of custom tray is advocated because it provides much more comfort to the patient and also it reduces the amount of material that is being used and thus saves the material. Next one is the economic factor. So there can be significant differences in the cost of impression material. We know that reversible hydrocolloid and irreversible hydrocolloid are less expensive than the elastomeric material. But to make a fixed prosthodontic impression, the practitioners usually use the elastomeric impression materials because they are more accurate than the hydrocolloids. So these are the ideal properties of impression materials. Next, let us discuss the principles of impression material manipulation. So why is impression material manipulation important? Because regardless of the impression material used, the proper manipulation of the impression material will give you an accurate impression. So let us see the principle. The first one being providing a uniform bulk of material. So in order to get an accurate impression, it is important to use a relatively uniform amount of bulk of material in the impression, because there will be uniform shrinkage throughout the body of the impression, and this shrinkage will be counteracted by the slight expansion of the gypsum casting material. The next factor is the proper adhesion of the impression material to the tray. So it is important that the impression material should properly adhere to the tray, and for this purpose we use specific chemical tray adhesives. The next principle is pouring of the impression material. So the time limit after removal from the mouth to when the impression is poured is also an important factor. So the water-based materials, that is the hydrocolloids, should be poured within 10 minutes of removal from the mouth. The condensation silicons should be poured within 30 minutes to attain maximum accuracy, and the polyether materials should be poured within 1 hour for maximum accuracy. And we have already discussed about the adhesion silicon. They can be poured at the convenience of the operator because there is no byproduct in the polymerization reaction. The next factor is about the viscosity control. So in elastomeric impression material, we get it in a number of viscosities ranging from very low to very high viscosity putty material. So the main difference in the different viscosities is the amount of inert filler in the material. So what is the importance of this viscosity? Lower the viscosity, better is the fine detail reproduction. And another important factor is that lower the viscosity, greater will be the polymerization shrinkage during the setting reaction. So there is one advantage and one disadvantage. One is that it gives a fine detail reproduction, but there is a disadvantage, that is there will be greater polymerization shrinkage. So the optimum method of impression making is to use a low viscosity material to capture the fine details of the prepared margin, grooves, etc. And the bulk of the impression should be made with high viscosity material. So for this, the heavy body material helps. They push the light body material into the gingival sulcus and results in minimum distortion due to polymerization shrinkage. And the final principle is about adequate mixing. We have already discussed about the auto mix system, and also the less expensive mixing guns. So these systems provide optimum mixing of the material. So they will have less inherent voids, improved working time, and it also reduces the wastage of material. So these are the principles of impression material manipulation. Coming to the different types of impression materials, so there is an extensive variety of materials for making a precise negative mold of soft as well as hard tissues, and in order of their historical development, they are the hydrocolloids, that is the water-based impression material, which are classified into reversible and irreversible. Then comes the polysulfide polymer, the condensation silicon next, and followed by polyether, and finally the polyvinyl siloxane or the adhesion silicon impression material. So now let us see one by one in detail. The first one is the reversible hydrocolloid, commonly called as the agar. So agar hydrocolloids are available as semi-solid gel in polyethylene tubes, and as the name suggests, the reaction is reversible. That is, the agar changes from gel state to sol at an elevated temperature of 99 degrees Celsius, and it reverts back to gel on cooling of up to 37 to 45 degrees Celsius. And the conditioning of the agar hydrochloride can be done by placing in three different baths. That is the liquefying bath, where the hydrocolloid gel is placed in boiling water for at least 10 minutes to liquefy it. And after liquefaction, the material may be stored in the sol condition, that is at 65 degrees Celsius, in the storage bath. And it can be stored for a range of 10 minutes to 5 days. That is, a number of tubes and syringes can be prepared for use throughout a week. Now, the 65 degrees Celsius is too hot for the oral tissues, and so it has to be tempered before impression making. So, for immediate preparation, the hydrocolloid salt should be removed from the storage bath. The tray should be filled with the salt and the gauze pad is placed over it, and then it is placed in the tempering bath, which is water filled, and it is at a 45 degrees Celsius and placed for 5 to 10 minutes. And then it is used to take the impression and then removed after it is cooled below the mouth temperature to ensure gelation. So this hydrocolloid impression material lacked dimensional stability primarily because of the process of syneresis and imbibition, and accuracy is improved with increased bulk of the material. So this is in contrast to that of elastomeric impression material where accuracy is diminished by increasing the bulk. So here accuracy is improved by increasing the bulk of material, and so there is an additional advantage that a custom impression tray is not required. So this is about the agar hydrocolloid. Next, coming to the most commonly used impression material in clinical practice, that is the alginate or irreversible hydrocolloid. Now, why is it called irreversible? Because once it is converted to gel state, it cannot be returned back to the liquid solution. And why is it called hydrocolloid? Because it consists of particles in gelatinous or the colloidal state in water. Now, what makes the alginate the most commonly used impression material? That is, it does not require any special equipment, and it is easy to use, and it is inexpensive, and it makes an accurate impression, allows for undercuts, and it is comfortable for the patient. Ideally, alginate is indicated for less critical application, that is opposing casts and study models, and they are hydrophilic and are not displaced from wet surface as easily as elastomers. Now, the setting reaction is usually a chemical reaction where the soluble alginate reacts with calcium sulfate to produce insoluble calcium alginate as a gel. So these are the features of alginate, and several advances have been introduced in alginate, like dust-free alginate where glycerin or glycol is introduced, and siliconized alginate where silicon polymers are added to strengthen the material, alginates containing disinfectants, and hard and soft gel alginate by adjusting the amount of fillers. Next, coming to the elastomeric impression material. So the GPT-9 defines it as a group of flexible chemical polymers that are either chemically or physically cross-linked. Generally, they can be easily stretched and rapidly recover their original dimension when applied stresses are released. So this include the polyether, polysulfide, addition silicon as well as condensation silicons. Coming to the classification of elastomeric impression material, four classifications are there. According to the chemical composition, classified as polysulfides, polysilicons that include condensation as well as addition silicons, and polyether. According to their viscosity, light body or syringe consistency, medium or regular body, heavy body or tray consistency, and very heavy body or putty consistency. And then according to the method of polymerization, addition polymerization material, that is polyether and addition silicons, and condensation polymerization material, that is condensation silicons and polysulfides. And finally, according to the method of dispensing, it can be classified as single phase system, two-phase system with pseudoplastic property, and three-phase system. Again, the current ADA specification recognizes three types of elastomeric materials, and this classification is based on their selected elastic properties and dimensional changes. So they can be classified as type 1, type 2 and type 3 based on their maximum permanent deformation, maximum flow in compression, and maximum dimensional change that's happening in 24 hours. Now let us discuss about the polysulfide polymer. So they are also popularly known as thiocol rubbers or mercaptan rubbers, and are composed of a base as well as an accelerator paste. The base consists of polysulfide polymer, tin dioxide and zinc sulfate, and accelerator consists of lead dioxide, dibutyl phthalate and sulfur. Now coming to the setting reaction. So reaction begins when base paste and accelerator paste are mixed, resulting in a polysulfide polymer and water as the byproduct. By this reaction, the polymer chains are lengthened and cross-linked through oxidized thiol groups. And initially, it results in increased viscosity and finally an elastic material. And the reaction is exothermic, and so it is affected by moisture as well as temperature. The polysulfide polymer is a hydrophobic material, and because of the presence of lead dioxide, it is radio opaque. And we know that the byproduct water Because of it, there is significant shrinkage on standing, so pouring of the impression should not be delayed. Coming to the manipulation of polysulfide impression material, so here the mixing time is 45 to 60 seconds and working time 5 to 7 minutes. And the materials are mixed on a mixing pad with a spatula, that is equal length of base and catalyst are dispensed on a disposable mixing pad, and the components are mixed thoroughly with a stiff tapered spatula. The catalyst is dark and the base is white, so thorough mixing is readily observed by lack of streaks in the mix. Now the material of medium or high viscosity is placed in a tray that has been painted with rubber cement adhesive, and the solvent from this adhesive is allowed to evaporate. Otherwise, the polysulfide material may separate from the tray during removal from the mouth. Coming to the properties, it has unpleasant odor and color, it stains linen and it's messy to work with, it's extremely viscous and sticky while mixing, long setting time causes patient discomfort, excellent reproduction of surface detail, and curing shrinkage is high, that is 0.45%, and among the elastomers this has got the highest permanent deformation. It's a hydrophobic impression material, and so the mouth should be dried thoroughly before making an impression, and the shelf life is good, around 2 years. Coming to the advantages and disadvantages, so it has got long working time, excellent tear strength, that's highest tear strength of rubber material, so they can be used in deep subgingival areas where the removal is difficult, and it has got good flow and good reproduction of surface details, high flexibility and lower cost compared to other elastomers, and these materials are highly compatible with model plaster and high strength stones. Now coming to disadvantages, we need to use a custom made tray because increasing the bulk minimizes accuracy. It has got bad odor, and also we have told it stains linen and it's messy to work with. Tendency is there to run down the patient's throat, and it must be poured within 1 hour, and it's hydrophobic, so impression area has to be dry. Now let's see some of the issues that may be encountered when using polysulfide rubber impression material. So the first one is inadequate working time, which could result from excessive humidity or temperature and an improper base to catalyst ratio. And next issue is distortion. So a number of factors causes distortion, one of which is too much of load, because the recovery after deformation depends upon the amount and duration of loading. And another reason is improper removal from the mouth, and if also there is internal porosity, that is bubble is located just below the surface adjacent to a preparation, that can also lead to distortion. The next issue is loss of detail, which can be due to premature removal from the mouth or removal prior to sufficient polymerization. Also, it can be due to incomplete mixing and failure to incorporate all the catalyst into the base, which can result in incomplete polymerization of certain portions of the surface. And next issue is bubbles or voids, and this could be caused by incorporation of air into the mix. So the impression material should always be mixed carefully, and if the material is partially polymerized prior to insertion in the mouth, that can also result in voids. Now these are some of the commercially available polysulfide impression material. So their brand names are Coflex, Omniflex, Permlastic, Neoplex, etc. Next elastomeric material is the condensation silicon, which is also called as the organotin silicons. So these are available as base and catalyst, and the base consists of polydimethyl siloxane, calcium carbonate and silica. Accelerator is ethyl silicate and stannous octate. So the consistencies available are light body, medium body and putty, and they are available in tubes as base paste and catalyst paste, and putty is available in jars. Now compared to polysulfide, this has got some advantages, which is it has got a pleasant odor and color, and an additional advantage compared to polysulfide is it has got very short setting time, around 6 to 8 minutes. So patients prefer condensation silicon over polysulfide. Now coming to the setting reaction of condensation silicons. So here cross linkage between orthoethyl silicate and the terminal hydroxyl group of dimethyl siloxane happens to form a three-dimensional network of silicon rubber. So this is an exothermic reaction and a condensation reaction also, with the byproduct as ethyl alcohol. So both the condensation silicon and polysulfide are condensation polymers. So the byproduct of their polymerization reaction gives off alcohol and water. So as a result, evaporation from the set material causes dimensional contraction in both cases. So as we said, it's an exothermic reaction with ethyl or methyl alcohol as byproduct. It has got a limited shelf life because of oxidation of tin, resulting in instability of alkyl silicate. And it has got intrinsic hydrophobicity. So poor wetting of the impression material by water may result in insufficient detailing in the presence of blood or saliva, and this should be prevented by addition of surfactants. Now coming to the manipulation. So putty is so stiff and it should be dispensed with a scoop and hand mix. A stiff spatula is used to mix the paste consistency, and setting time is 6 to 8 minutes, which is less compared to polysulfide. And the tray adhesive used for condensation silicons include polydimethyl siloxane and ethyl silicate. Now let's see the properties. It has got a pleasant odor and color, mixing time of 45 seconds, setting time 6 to 8 minutes, excellent reproduction of surface details, highly elastic, lesser dimensional stability and high curing shrinkage. It has got permanent deformation due to shrinkage caused by evaporation of ethyl alcohol. It's hydrophobic, so needs a dry field, biologically inert, and it's compatible with all gypsum products. Now let's see the advantages and disadvantages. So advantages include it has got a pleasant odor and color, and it's highly elastic. It is available in different viscosities, light body, medium body, heavy and very heavy or putty. And the putty wash system improves accuracy and eliminates the need for a custom tray. Now the disadvantages include inaccuracy due to shrinkage, must be poured within 1 hour, hydrophobic, so needs a dry area, and the liquid component of the paste liquid system causes irritation. Coming to the issues faced during the manipulation of condensation silicons. So first one is inadequate working time, which is due to excessive humidity or temperature and an improper base to catalyst ratio. The next issue is distortion, which may be due to incorrect separation from the impressed structures. And impression can also become distorted if there is inadequate support of the impression after removal from the mouth. And possible shrinkage may be resulting from continued polymerization and vaporization of the volatiles in the silicon rubber. That is due to the condensation reaction. And this shrinkage can be compensated by use of double impression technique, where a preliminary impression is made with a very high viscosity material, that is usually putty, and providing space for the final impression that is made with low viscosity material. And here the preliminary impression that is made with high viscosity material is used as the tray. So in detail we'll be discussing in our coming slides. The next issue is the loss of detail, which is due to premature removal of the impression from the mouth and failure to allow the impression material to set adequately or an incomplete mixing. And failure to maintain the tray in a stable position also will result in a blurred impression. Now these are some of the commercially available brands of condensation silicons. Next, let's discuss about polyvinyl siloxane, commonly called as addition silicon, or it's called as vinyl polysiloxane or vinyl silicons. So the mode of supply is in collapsible tube, that is base paste and accelerator paste. Putty is supplied in jars. So the base consists of polymethyl hydrosiloxane with hydrosilane group and fillers. Accelerator consists of dimethyl siloxane with terminal vinyl group, chlorplatinic acid catalyst and filler. And four consistencies are available, that is the light body, medium body, heavy body and putty consistency. So addition silicon is similar in many aspects to condensation silicon, except that it has got much greater dimensional stability, almost similar to polyether. Coming to the setting reaction, here the vinyl groups of the base polymer is cross-linked with the hydride groups, resulting in the silicon addition polymer. So this is an addition polymerization reaction, and here there are no byproducts as long as correct proportions are maintained. And a secondary reaction happens between the moisture and the residual hydrides of the base polymer, which leads to development of hydrogen gas, and this will result in pinpoint voids in the gypsum cast. So in order to prevent this, platinum or palladium is added in newer products which act as the scavenger. So this will prevent the escape of gas at the polymer cast interface, or else you can delay pouring for an hour or more according to the manufacturer recommendations. Now, selection of gloves is important in the manipulation of adhesion silicons. Latex gloves are not indicated for adhesion silicons because the sulfur compounds present in latex gloves retard the setting of silicons by reacting with the platinum catalyst, and this inhibition of polymerization reaction produces major distortion. So, vinyl nitride gloves are indicated which do not have such an effect. Coming to the manipulation of adhesion silicons, so it is available in paste system, that is base and catalyst, and putty in jars, and they are currently supplied usually in auto mixing cartridges with static mixing tips or a mechanical mixer with dynamic mixing tip, or the very high viscosity adhesion silicon is supplied as a catalyst and base putty which is dispensed with scoops, and you can mix it by hand, and for this tray adhesive is required. Now, usually adhesion silicon is generally used as a two viscosity system, but monophase formulations are also available. So these are single consistency materials that have been formulated with sufficient shear thinning to be used as both low viscosity and high viscosity materials. But it is easier to trap bubbles when using the monophase materials. Now coming to the properties of adhesion silicons, it has got a pleasant odor and color, excellent reproduction of surface details, mixing time 45 seconds and setting time 5 to 9 minutes, best dimensional stability, low curing shrinkage, lowest permanent deformation, and but it is extremely hydrophobic. So some manufacturers add a non-ionic surfactant to make it more hydrophilic, and good shelf life of 1 to 2 years, and finally good tear strength. Now let's see the advantages and disadvantages. Advantages include high accuracy, high dimensional stability, and recovery from deformation on removal is excellent. It may be used with stock tray or custom tray. It can be poured even after 1 week. Multiple pours are possible. So the reproduction of detail, adhesion silicons are currently considered to reproduce the greatest detail among all the impression materials. Coming to disadvantages, it is expensive, twice the cost of polysulfide. It is more rigid than condensation silicons. The sulfur in latex gloves, which we have already discussed, inhibit polymerization. Pouring of the stone should be delayed by 1 to 2 hours because of the liberation of hydrogen gas. Otherwise, scavengers should be added. Now let's see some of the issues encountered while working with adhesion silicon. The first one is inadequate working time, which may be due to increased temperature. So increase in temperature results in decreased working as well as setting time. Next, if the impression material does not set, this may be due to the catalyst contamination. So here the platinum containing catalyst becomes inactive after contacting certain substances such as tin or sulfur compounds. The next issue that is faced is loss of detailing. So these are hydrophobic materials and they cannot displace any moisture or hemorrhage. So that every moisture and hemorrhage should be removed prior to the placement of impression material. The next issue is porosity, which is due to the liberation of hydrogen gas. We've already discussed it. So this can be prevented by adding scavengers or by pouring the dyes after 1 hour. The next issue is distortion. This happens when polysiloxane adhesive does not provide adequate retention. So in such cases, mechanical retention should be added in combination with the adhesive. Now these are some of the commercially available adhesion silicons in the market. Coming to the next elastomeric impression material, that is polyether. So this is supplied as collapsible tubes which consist of base paste and accelerator paste, and third tube may be supplied which contains a thinner. So the base includes 1,2-epoxy ethane copolymer, tetrahydrofuran reacted with crotonic acid, and accelerator include aromatic sulfonate ester, that is a cross-linking agent, and colloidal silica as filler, and phthalate or glycoether as plasticizer. And three consistencies are available, that is the light body, medium body, and heavy body consistency. Coming to the setting reaction of polyether, so these polyether impression materials set via a unique ring opening polymerization reaction, and this reaction is called as cationic polymerization. So cationic polymerization is similar to addition polymerization, except that instead of a free radical, a cation, that is a positive ion, is the reactive molecule, and there is no byproduct in this reaction. So here cross-linking is brought about by the aromatic sulfonate ester and results in the formation of a cross-linked polyether. Coming to the manipulation of polyether, which is available as base catalyst phase system. So it can be used in automatic cartridge and mixing gun or in mechanical mixer with dynamic mixing tip. And the unreacted polyether should be removed with organic solvents like acetone, chloroform, or with soap and water. And the set elastomer should be removed with chloroform or other chlorinated solvents such as trichloroethylene. Now we have already said that tubes of thinners will be available, which increases the working time and flexibility. So in such cases, an equal length of thinner should be mixed with base and catalyst, and this results in increased working time and increased flexibility. Coming to the properties of polyether, first one, it has got a pleasant odor and taste. The mixing time is 30 seconds, setting time 8 minutes, and the dimensional stability is excellent because no volatile byproduct is formed. And the curing shrinkage is low, permanent deformation is also low, but thermal expansion is comparatively greater. And the material is very stiff, and this may cause problems when separating a stone cast from the impression, especially in case of thin and single teeth. There is chance that it may break. And it is a hydrophilic material, so there is no problem of moisture control, and the shelf life extends up to 2 years, and polyether is stable only if stored dry because it will absorb moisture and undergo significant dimensional changes. Also, some cases are there of allergic hypersensitivity in polyether elastomer. Coming to the advantages and disadvantages, advantages include pleasant mixing and ease of handling. It's more accurate than polysulfide and condensation silicon, good surface detail reproduction, easily poured in stone, and if kept dry, it will be dimensionally stable for up to 1 week. The disadvantages include high cost, high stiffness, bitter taste, allergic hypersensitivity. 0.5% of patients exposed to polyether showed allergic reaction due to the aromatic sulfonate catalyst, and this cannot be electroplated. Coming to the issues encountered while working with polyether, first one, inadequate working time. So an increase in temperature will decrease the working and setting time. Also an improper base to catalyst ratio will decrease the working time. Now tearing, the rigidity of the material result in tearing upon removal of the impression from the mouth or of the dye from the impression, and also it happens because the rubber thickness is inadequate. Distortion, due to the moisture absorption or plasticizer extraction, dimensional change happens when the impressions are stored in high humid environments or exposed to water. Then finally, loss of detailing. The rigidity as well as relatively low tear strength of polyether result in progressive deterioration, especially at the gingival margin of the impression. So the impression may absorb enough moisture from gypsum, and multiple pores can result in swelling. Now these are some of the commercially available polyether brands in the market. Next, we are going to discuss the techniques of impression making, and that will be continued in our next session. So thank you all for watching my video. Please do like, share and subscribe my channel if you are finding these videos useful. And if you have any queries, doubts, suggestions, topic that needs to be discussed, you can comment below this video or you can mail me at this mail ID. So it's bye from Processor Hub until our next session.